We at the John C. McDonald Regional Transplant Center understand that the evaluation process can be very confusing and very stressful. Our goal is to make this period as simple as possible.
Once a referral is received, you will be contacted by our team to set up an appointment. It is very important to answer this call as no appointments are set up until you've spoken with our team.
Our intake coordinator will complete a phone assessment with you before you're added to our schedule. Shortly after, expect to receive a new patient packet with all the information you need for your first visit.
Your first visit with transplant is your education day. You'll have nurses explaining the transplant process, and you'll be meeting members of our team,
Such as our social worker, our dietitian, the pharmacist, financial coordinator, and others. You will also meet with our transplant physicians and have lab work drawn that day.
Expect to be at your appointment for 4 to 6 hours. Feel free to bring snacks or your lunch, but we also have a cafeteria directly across the street.
After your first visit, the nurse and doctors will inform you of any additional testing that's required to make a determination about your case. This could include cardiac clearance, a colonoscopy, and potential radiology testing such as MRIs or CT scans.
All of this will be explained to you as it's scheduled. It could take 1 to 2 months depending on how extensive your testing is. That is why it is so important for you to keep all scheduled appointments.
After your testing is complete, your coordinator will present your information and your history to the selection committee, and a decision will be made at that time whether or not you're a candidate, and then you will be notified of the outcome.
Unfortunately, some patients must be closed. This can be due to multiple reasons which can sometimes be resolved. You'll receive a letter in the mail explaining why you were closed and what steps you may take next.
At conference, you may be deferred. Usually under deferral, there's a temporary issue that can be resolved within about 6 months, and transplant will work with you to achieve this so that we can get you listed.
If you are deemed an acceptable transplant candidate, you will receive a letter in the mail, and you will be contacted by a waitlist coordinator to go over all of the information needed as you wait for your organ offer.
The transplant team is always here to help guide you through this stressful time.
We are always here to be supportive.
We're always here to answer your questions.
The Willis Knighton Transplant Team is always here for you.